Now we are moving on to a slightly different topic. We're moving on to public health and healthcare policy making, and the question how this can be aided by geographical data. And Jessica Ortiz is going to talk about that. She is from the Deggendorf Institute of Technology. Welcome, thank you.
So, hi everyone, my name is Jessica, and I work in the European campus from the Deggendorf Institute of Technology. As I was doing my medical social service in Mexico in a rural area that looked exactly like this, I needed to collect a lot of data, and this data was collected house by house, trying to see, for example, how the elderly were doing, if they had any diseases, if they had water service, and which diseases were in a way attached to any of this situation that these people were living. So these are the conditions where I did my social service for the medical bachelor, and there are some problems that I detected. So at that moment, I didn't know about many solutions because it was like a decade ago. But I did got a good tan, and I got very fit walking around through all these beautiful villages. But I found out as I studied this master's in medical informatics how to figure out for a solution for people like me that are doing the social services in the rural area, where we get a lot of inaccurate data, because it is inaccurate because you do everything by paper, and you need to do this 2 to 3 times a day, 7 days of the week, because you cannot just go on vacations to your home and then come back after 600 kilometers to such a rural area. So you need to be 24/7 in such a service, even in emergencies. There's a lack of a common geospatial platform, and that is called Geographic Information Systems. Does anyone here know what Geographic Information Systems is? Thank you. So the lack of information also from us as being trained in the healthcare facilities, where we don't know all the systems existed, and right now is being, of course, of the digitalization of the healthcare. So we did a lot of, there's a problem with data security, how to share, of course, personal data or private data with the patients or with the government, and the cost of training local people and the mobile infrastructure. So if you try to right now train people to do this kind of services and to get accurate data from the rural areas, it costs a lot of money, and this is one of the borders that is being tried to overcome with such a facility. And the data collection, you cannot see it properly there, but it says that it's paper-based. So we are all trying to digitalize healthcare, and we are all trying to digitalize healthcare mostly in the urban areas. And the rural areas, it's a place where we should start, because this is the best study group that we can have because of the digitalization and the infrastructure that it could be needed. So just really, I'm not going to give a lecture about GIS, but we can use it to analyze a lot of data, to build application development, to visualize this in a cartography. And this cartography or this map could be used for most of the people, as it could be public. The public cartography would not include any personal or private data, and it usually doesn't. It is just the measurement, for example, of clusters or any kind of I would say, localization or geolocalization. You can relate whenever you use Google Maps and you go to a restaurant and you want to see the grade from it. Well, if you apply it to healthcare, it could work also like that, but taking advantage of the measurement of the diseases. And you can create any data administration and relate it, for example, for research, and to see any kind of clusters. For example, if I'm trying to make a research on healthcare or dementia, etc., you can localize your cluster. You can localize your clusters easier, and you do not manage any personal data. You're only managing statistics and epidemiology, which makes it easier, at least for the researchers, to do this. We are trying to develop a mobile desktop and web that looks a little bit like this. It's a little, it's easier explained, where you can map or create any kind of content. You can map even routes, or you can use even, you can map the routes for the healthcare, for example, the Rettungsdienst, etc. Emergency calls or home visits from the doctors to see which patient was there, which patient is doing good, and to use, for example, a database to create geodata or a client data, even attach some pictures, etc. from it. And you can see this as a map to see how it works. This is how we're working on the team. Anna is unfortunately not here, but we have a team of a GIS specialist and lab engineer, and of course myself until right now as a primary healthcare specialist. If you think how GIS is growing, or GIS will grow until 2024. There's a report that the geolocation or geographic information systems, I'm not talking about healthcare, I'm talking here about in general, it will grow. Of course, in America it will grow more, and we will be using it more here in Europe. These are, in a way, the competition, but as you can see, most of the industry that is using it, they're using it for automobiles, they're using it for everything that is not healthcare, but Esri. Esri is one of the only companies, it's a worldwide company that is using this in healthcare. They have a product that is usually used by the government, or it has a governmental use because the government needs to use it and apply it, and they also have a service. You pay for the service and they give you the service. The difference between all this and what I'm trying to build here is the access to it, because I cannot pay that amount of money that Esri, for example, will go, or I will use it within my institution. But if I am in a rural area, it will be very hard for me as a GP or nurse or any dentist or healthcare to have such an application to make my work easier from the bottom up. Because usually all of these companies and industries, they go from up to bottom. And usually the poor countries or developing countries do not have that amount of money, or they are not still there to think, how can I put this bottom up? Or how can this affect better, or how can I plan better my healthcare? So right now we are trying to make a 2-year action plan. We are over there right now, so we're trying to, we finished a little bit our documentation, and we're planning to have at least a minimum viable product, so in the middle of November, December, finishing all our research to see if there's any application already there. And to make a test, we will try to test it with a research that is called mHealth as a tool to improve monitoring, management, and cardiovascular diseases associated with depression. So if you think about all this topic that I just told you, and I can upload data offline, because this is how it will look in a rural area, you do not have, or you maybe do have any kind of network, but sometimes you don't, or it will be hard to upload or download data. In such a complicated, let's say, research, with offline, that we will have a lot of difficulties, hopefully, to test how easy can this go up and make an interactive map. But not for me only to use, but to make it available as statistics also for other researchers that would use the same information, maybe in the same geographic area, to improve anything, to make more apps or to make any more startups that will bring, of course, and hopefully more attention to the rural areas. Thank you.
Great, thank you. Any questions? Yes, one.
Thank you very much for this wonderful presentation. I'm asking about the geoinformation systems in primary healthcare, do you have like a first use case actually that you want to deploy somehow?
I was, myself, I was doing this social service. I use that as a primary use case, for example. But unfortunately, I cannot go back to Mexico to do that. That would be great. But we want to do this, trying a rural area in Bavaria, for example, but trying to do this offline, as we will be in a rural area like I showed you. So the primary use case would be to use it making a cardiovascular risk, trying to, how can I say that? The same that you do in the rural area to map. I would not go house by house, because in Bavaria it's a little bit hard to go knock on and say, can I please see if you have a high blood pressure? But to use, for example, any hospital or any care, for example, Caritas, etc., to prove and to see if we can recollect this data and try to make this rural area a rural area, and hopefully afterwards we can really test it in a real rural area, not only in Mexico, but we can have it also in Africa, Mongolia, etc., where you have a lot of clusters that are not being measured because you cannot. They are nomads, so you have to take advantage of the time and network. Yeah.
Great. Thank you very much.
Thank you.